We have a culture in America that's sort of evolved into being in the perfect position, like a perfect storm for a global epidemic with addiction. And there's a reason that it started in the United States.
Opioid crisis.
The opioid epidemic.
The opioid crisis.
The opioid epidemic.
The opioid epidemic is getting worse.
At last report in 2017, Iowa recorded 202 opioid-related overdose deaths. That's a 3- or 4-fold type of increase over the last decade.
Conventional wisdom at this point is that the opiate crisis is a crisis that at least has been exacerbated, if not created at this point, through the health system.
When a doctor, based on advice from pharmaceutical companies, gives you something that solves a problem and doesn't tell you it's risky, not only that, when it's coming from a doctor, you don't even perceive that it could be. Because who'd imagine a doctor doing something bad for you? Boy, that's a recipe for a large-scale pattern of usage.
With opioids, we have not had the numbers that a lot of other states have. Our deaths have not been as many. And we've not seen as much of the heroin or the fentanyl analogs, but it's all trending up.
Talk about substance abuse broadly in the city of Ames, it's very obvious that substance abuse, including alcohol, marijuana, and other substances, is a big problem. But I think when you ask people about opioids, some people are just like, what are opioids? They don't see heroin as a source of opioids. They just see it as a, some type of, type 1 drug that's just not good for people. So when we go out and talk about opioids specifically in the city of Ames, I don't think people really know what resources are available, because frankly there aren't that many.
We're not having overdoses every day. We're not deploying Narcan every day like places in Ohio and Indiana, but it's coming this direction. We have had 3 cases in the last month where we've administered Narcan and brought somebody back, probably saved their life.
If you're overdosed on fentanyls or any opioids and in threat of dying, they give you naloxone, you're cured. At that moment, you're healed. An hour or 2 later, you're not anymore. So if you start taking drugs again, boom, dangerous.
Originally from a small rural community in Indiana. It's called Crawfordsville. I think about the time I was born there was about 8,000 people, but about the time I left there's about 15 to 16,000. I grew up on a sheep and cattle farm. My parents were married up until I was about 13. I had a time where my mom had actually fallen down a flight of stairs. She ripped her rotor cuff in her shoulder, and because of that she had to have surgery. And because of that surgery they put her on medication, opioid medication. And then it was just like one surgery after another, and then next thing you know, it's years and years of being on opioid medication. Eventually, my mother did become addicted to opioids and had to eventually seek help, but there were a number of years where she was selling, she was snorting, she got in trouble with the law, she ended up spending some time in jail. Quite a significant amount of my high school, last 2 years of high school, she was in jail. If I had to describe it in one word, I would say devastating. Seeing someone you love go through something that, as much as you'd like to believe that they can control it on their own and just get off of it, they can't. When I looked at our health department statistics for Montgomery County, Indiana, where I'm from, in the month of September, they had 58 overdoses. There's only like 25,000 people in the whole county, so that's a significant amount. They had to build a morgue in my community because of the opioid overdoses, and I'm under the understanding at least 5 people in my high school graduating class the year before the year after have overdosed because of opioids. It's had a huge impact on my community.
Treatment in America is underfunded. There aren't enough beds and facilities, and there aren't enough doctors to deal with it.
Iowa does not have very well-funded mental health care. We do not have a very comprehensive system which aids people with mental health problems. That includes substance abuse problems. When you have a substance abuse problem, there are options, but you're also largely on your own with it too, and that's kind of scary.
The Iowa Department of Public Health has done a lot of work to expand medication-assisted treatment centers and services. I think we've seen it's a doubling, almost a tripling of the providers who are prescribing the medications that are used as part of the opioid-related medication-assisted treatment regimen across the state. We still don't have enough because access to that is still difficult for a lot of Iowans, especially in rural areas. So I know that substance use disorder treatment providers are working to expand.
I think that with opioid dependence, what you find is it occurs rapidly. So sometimes a little more rapidly than other substances. Opioid withdrawal also looks different. It is very painful. What opioid withdrawal really looks like is having the flu, like a very severe type flu. Detoxing from opioids can take anywhere from 7 to 10 days.
I remember distinctly in my conversation with Ames Police Department, I asked the chief, what could you do if someone came in here today saying, I need help, I'm addicted to opioids? And his response was, unfortunately, the only thing we can do is put them in jail.
Opioids are a horribly hard thing once you're addicted to get off of. And it's hard to treat. It's hard to find doctors who are willing to treat it. One of the doctors that we have locally here, he works a couple of days a week in Ames, that can prescribe something called Suboxone, which is one of those things to help with the withdrawal symptoms of opioids. And he said a very interesting thing in our town hall meeting, that his license as a physician allows him to prescribe as many opioids as he wants, but it limits him to 260 prescriptions for Suboxone. In essence, what he said was he can get as many people as he wants addicted to it, but he can only help 260 people get off of it.
So what we have is we have a forest fire. And when you have a forest fire, what do? You pour water and everything you can to put the fire out. It's a big deal. But it took a long time for the National Forest Service to come up with Smokey the Bear, preventing forest fires. What Iowa needs to do with this crisis, I think they're starting to do. Legislation is in the House and Senate now that's probably going to get approved, that's going to do a lot of good things. But I think sometimes people forget, what the real issues are.
It is very clear that we have markedly changed our attitude towards pain medication over the past 5 years, especially. We used to give out what were called Vicodin 6-packs in emergency room. We don't do that anymore. We have the prescription monitoring program, which monitors how many prescriptions for opiates and other C2s are filled by patients on an ongoing basis.
I think one of the biggest problems is that people don't look at opioid addiction as a social problem, they look at it as an individual problem. So if they see someone that's on heroin, they're like, oh, look at that junkie, go get a job. get your stuff together, you have a family to raise, you have people that are counting on you. When in reality, they should realize that the person started on those opioids from an injury that could happen to anyone. For my mom, it was falling down a flight of stairs. She became addicted to those medications, which then in turn led to heroin addiction, which then in turn led to run-ins with the law and theft and forgery and different things like that. It's a snowball effect. I think one of the biggest barriers to addressing the problem, both in communities like Ames that are trying to be proactive, and then communities like mine of Crawfordsville, where they're just really plagued with the issue right now, is having the conversation about it before it happens.